From a staffing perspective, and specifically emergency department nursing staffing, it's as bad as I've seen it. And I've been practicing for 9 years.
Emergency medicine director Tim Chaplin says staffing shortages and high patient volumes have forced Kingston Health Sciences Centre to cap the number of patients to the urgent care center at Hotel Dieu Hospital. Starting Wednesday, KHSC will begin limiting the daily number of patients treated at the urgent care center in an effort to make resources available at the emergency department at Kingston General Hospital, the region's main trauma center.
We feel like we're at a point now where we need to prioritize the operations of the emergency department to ensure those trauma patients, those strokes, those heart attack patients with heart attacks are seen with the appropriate complement of staff. And it's no longer possible or safe to continue to divert human resources to the urgent care center.
Which means physicians at the Dieu's urgent care will determine on a daily basis how many patients can be safely cared for, capping that number at 120.
120 would have been a fairly typical day at Hotel Dieu Hospital before the pandemic. But recently we've been seeing up to 150 patients a day at the urgent care center. And that's simply not sustainable.
Dr. Fitzpatrick says recent doctor retirements have made the situation worse, noting KHSC would need to hire 8 more physicians in order to meet the increased demand, and the nursing shortage is worse.
In terms of nursing staff, we often run with a nursing staff schedule that's about half or a little more than half of what we would normally have.
Along with capping patients, urgent care may close earlier than 8 p.m. on certain days. Patients who arrive after the doors have closed will be encouraged to seek care elsewhere, like the KGH ER, walk-in clinics, or wait for urgent care to reopen at 8 in the morning.
We would like patients to pause and say, can this issue wait? So I apologize, and I think the hospital will apologize for any inconvenience this causes, but ultimately we feel like it's a step in the right direction.
Both Dr. Fitzpatrick and Dr. Chaplin say it's hard to determine how long the cap will last, but it will likely take months to hire and train the staff needed to meet the demand. Erin Strickland, Global News, Kingston.